Now it is time to start the thin needle aspiration biopsy. The first step is careful palpation of the target. Ask yourself how large the mass is and how deep under the skin it is situated. Also, consider if there are any structures nearby that you would like to avoid. Such structures may be major blood vessels, the trachea, or bony parts. Based on this information, plan for the angle of the needle and the depth of penetration in order to get in optimal position. Most targets can be approached at a 90-degree angle, but in most cases it is more comfortable and practical to use a 45 to 30-degree angle. When using the 90-degree approach, the needle should penetrate the skin right on top of the nodule. If the same entry point is used with a 45-degree angle, the needle will in most cases not enter the target. Instead, one has to compensate for the more acute angle by penetrating the skin adjacent to the mass. Failure to place the needle correctly is one of the most common causes of poor healing. Next, I will position the patient and myself for the procedure. The goal is a good specimen, and that, in my experience, is easiest to achieve if both I and the patient are in a comfortable position. More than one position may be considered before going ahead. For instance, in this patient with a submental node, I can either position my hand like this and aim the needle in this direction, or change my approach this way. Most people have a slight hand tremor. This may interfere with the exact needle placement, especially in small targets. Potential problems may be avoided by stabilizing the instrument, and this can be achieved in several ways. One possibility is to lean the barrel of the syringe against the forefinger of the palpating hand. Make sure not to use the needle for support, since this will cause contamination. In order to get a good angle for sampling, it is necessary to bend the fore and middle finger in this fashion, as opposed to keeping them flat on the patient's skin. Using the thumb like this is another way of stabilizing the instrument. Once the needle has been placed in the target, the support is not necessary anymore and can be withdrawn. Both these positions may feel awkward at first, but with some practice they will be very helpful.